Hello everyone, I am Dr. Kona Himabindu Reddy, Consultant Pulmonologist, Prathima Hospitals, Kukatpalli. So in this session, I am going to discuss about sleep apnea. So sleep means, the sleep apnea happens in the sleep. Apnea means cessation of breathing. So there is a breathing issue in the sleep, that is called sleep apnea. So normally during sleep, the air moves in and out through the nose, throat and into the lungs. So in sleep apnea, this air movement or air flow is diminished or completely stopped periodically. So that is called sleep apnea. So there are two types of sleep apnea. One is obstructive sleep apnea, another is central or non-obstructive sleep apnea. So in obstructive sleep apnea, that air flow or air movement is diminished or stopped because of narrowing or blockage of the airway in the throat. And in central sleep apnea or non-obstructive sleep apnea, the airflow is diminished or stopped because of change in the breathing control and rhythm at the level of brain. Here the throat remains open throughout the sleep. So these are the two types of sleep apneas, and few people will see the mixture of both sleep apnea, obstructive and non-obstructive components. So whatever is the type, so the airflow is limited during sleep apnea. So because of limitation in airflow, there is decrease in oxygen levels and increase in carbon dioxide levels in the blood during sleep. So that definitely hampers the functioning of the vital organs periodically during sleep. So definitely sleep apnea is a serious problem, serious health issue. So that affects the daytime alertness, which directly impacts your safety while driving motor vehicles, and also your performance at the workplace, and also leading to chronic lung issues and chronic other health issues. So now we are going to discuss about obstructive sleep apnea. So in obstructive sleep apnea, what will happen during the sleep? So during sleep, in obstructive sleep apnea, the airway in the throat is narrowed or completely blocked. How will it happen? So normally the throat is surrounded by the muscles which hang from skull, jaw and surrounding the flexible airway in the throat. So these muscles control the breathing, speaking and swallowing. So during sleep, these muscles surrounding the throat, they are relaxed. So that will cause narrowing of the airway. So in many people, this airway narrowing does not impact on the breathing. But in few people who are at risk, like who are obese or who are overweight, and also who have anatomically small airway, small upper airway, that is small lower jaw, that definitely narrows the throat space. So these people are at risk to develop critical airway narrowing during sleep. So in these people, when the airflow is limited along with partial obstruction of the airway in the throat, that is called hypapnea. So when there is complete blockage of the airway in the throat without airflow, that is called apnea. So both hypapnea and apnea, there is limitation of airflow during sleep periodically. So this will cause decrease in oxygen levels and increase in carbon dioxide levels in the blood during sleep. And to open the airway, that person who is sleeping, that person, he may awaken and activate the muscles surrounding the throat. So which will open the airway and restoring the normal breathing pattern. So as the person, he or she awakens, so there may be short movement of limbs, or sometimes they may snore. And sometimes when there is critical narrowing of the airway in the throat during sleep, so the person may awake completely with the sensation of gasping or choking. And if that period of awakening is very short, then the person falls back to sleep immediately, then that person doesn't even remember that event that happens during the last night. So that's the reason most of the people who have been suffering from sleep apnea, they doesn't even know that what the problem they are facing during the sleep. and most of the times the bed partners or spouse detect the problem and insist them to seek medical attention. So that's why gaining knowledge regarding this issue is very important. And what are the reasons for obstruction at the level of throat? So most common reasons are obesity and overweight. The fat accumulation, fat deposition surrounding the throat narrows the airway, that will further narrows during the sleep, causing sleep apnea, obstructive sleep apnea. And another issue is tonsils enlargement, adenoids enlargement, especially in the children, will narrow the airway, causing OSA in children. And also few people, they have small airway, small jaw, small upper airway and big tongue compared to their size of the mouth, will definitely narrows the throat space and causing airway narrowing during the sleep. And these people are at risk of developing obstruction during the sleep, causing airflow limitation or decreased breathing during the sleep. So what are the symptoms we'll get when we are facing this issue during sleep? So the majority of symptoms are sleepiness, excessive daytime sleepiness, loud snoring during sleep and fatigue. So but majority of symptoms are ignored by many people. So that loud snoring, usually the patient who is sleeping doesn't even aware of the snoring, and usually bed partner notices these symptoms. And fatigue and excessive daytime sleepiness during daytime, definitely that is attributed to increased work and increasing age by majority of people. So they ignore their symptoms and they don't even seek the medical attention. So these are the most common symptoms. And frequent awakening during sleep leads to the unrefreshing sleep and early morning headaches, sore throat, dryness of throat, and decreased concentration on the work and decreased memory power. And excessive daytime sleepiness may lead to the road traffic accidents, and even decreased memory power impact the work efficiency also. And these are the most common symptoms. And what are the consequences and complications associated with obstructive sleep apnea? So the most common complications are associated with decreased oxygen levels while we are sleeping. So these decreased oxygen levels will affect the functioning of the vital organs like brain, heart, kidney. So that majority of organs, they need oxygen supply 24/7. So when there is decreased in oxygen supply during sleep, definitely hampers their function, vital organ function like brain, lungs and kidneys. So that will lead to the long-term health issues like cardiac issues, heart attacks, and change in heart rhythm like arrhythmias, and high blood pressure, and uncontrolled sugars in spite of adequate treatment, and stroke and lung disease. So these are the major consequences. And the persons who have severe OSA are at more than double the risk of facing motor vehicle accidents compared to the persons who don't have OSA. So definitely this is a serious issue. We need to identify our symptoms and we have to consult our specialist immediately. So these are the most common complications facing by the persons who have been suffering from obstructive sleep apnea. So what will happen? How does this obstruction happen during sleep? So normally that muscles surrounding the throat are usually relaxed during the sleep. So that will cause partial obstruction of the airway by having small airway and having large tonsils and large adenoids. Already the airway is narrowed, and during sleep when the airway is further narrowed, causing the obstruction of the airway, leading to the low oxygen levels, apneas and snoring. So how will we diagnose this problem? So when the person come to the specialist with the complaints of snoring and excessive daytime sleepiness and easy fatigability and lack of concentration, early morning headaches, the doctor takes proper history, and after examination he advises few investigations. here in history taking, the spouse or bed partner history is a crucial, because most often they notices the symptoms like snoring and awakening with gasping and choking and excessive daytime sleepiness. So the bed partner opinion is crucial in diagnosing this problem, and after taking proper history, doctor examines you, like he checks your body weight and he calculates your BMI. If you are overweight or obese, you are at high risk of having OSA. And they measure your neck circumference, like most commonly more than 17 inches in males and more than 16 inches in females are at high risk of developing obstructive sleep apnea. And they examine the upper airway, they check your tonsil size, especially in kids, tonsillar enlargement and adenoid enlargement they look for, and also they will measure the throat space and whether we can see the throat through the mouth because of large tonsil and narrow throat space. So based on the examination, after examination, doctor specialist advises you sleep study, overnight sleep study, that is called polysomnography. So the sleep study measures your breathing effort, airflow during sleep, and also heart rate and rhythm and various duration of various stages of sleep, and your leg movements, chest movements and body movements, and also your oxygen levels. So based on all these parameters, so usually we diagnose your obstructive sleep apnea. And there are certain parameters like AHI, apnea hypopnea index. So based on the, after measuring this AHI index, we'll come to know the severity of the OSA also. And these sleep studies ideally should be performed in the sleep labs, but now because of the patient's convenience and lot of other factors, now home studies are also available, and they connect few like connections like ECG leads and EEG leads and chest bells, and based on that, so they'll connect and you sleep at your home in your bedroom, and they check and they calculate the parameters during the sleep, and after in the morning they will come to know the AHI index and lot of other parameters. Based on that, we will diagnose your obstructive sleep apnea. And after diagnosis, what are the treatment options available? So the most common and goal of treatment is to keep your throat open during the sleep and avoid snoring episodes and avoid the fall in saturations and improve your daytime symptoms. This is the main goal of our treatment, and lot of treatment options are available. Now the selection of treatment is mainly based on your severity of the problem, and also based on your severity and also acceptance, clinician acceptance and patient's acceptance. So the initially for moderate to severe cases, the most common treatment we opt is Cpap, continuous positive airway pressure. So here the pressurized air is delivered through a machine into your throat while you are sleeping, so that will keep open the throat during the sleep. So that will avoid fall in saturations and apneic episodes. So this Cpap therapy is a primary option, treatment option for the OSA patients. So this Cpap, usually there is a small machine which can easily moved from here and there. Even during transport also you can use this machine, and this machine contains one mask. There are three types of masks: nasal pillows that we insert into the nostrils, and nasal mask that covers your nose, and that oronasal mask that covers both nose and mouth. So that mask is well fitted on your face with the help of straps, and this mask is connected to a machine through tubes. This machine delivers pressurized air which keeps your throat open during the sleep. So that will avoid your airway narrowing and snoring episodes and apnea and hypopnea episodes. So what are all the problems we face while using the Cpap machine? So most commonly the problems associated with the mask. If you use it very tightly, then that may cause skin irritation, skin redness, and sometimes even for long term, who are using on long term basis, that may cause minor ulcerations of skin also. And even nasal pillows and nasal mask may cause nose dryness and nose irritation. So in that case, then we advise to use humidifier along with Cpap machine. So these are the most common problems we face while using Cpap at home. And one more is the claustrophobia and suffocation. Most commonly we see with oronasal mask. So because of this reason, most of the patients, they remove the mask after midnight or in the early mornings. But this is a major issue with the compliance. So using less hours, few hours definitely impacts the efficacy of the machine. So after troubleshooting these issues, so if you use it regularly, and then the efficacy of the treatment is very high. And one more thing is the pressure titration. How much pressure we have to use for the Cpap machine. Previously we used to calculate through the titration while doing sleep studies in the same night. But now auto Cpap machines are available in the market. They self measures or self titrate their pressures while using Cpap at your home. And before advising a Cpap machine to the patient, doctors need to educate them and explain them regarding the troubleshooting and what is the efficacy of the treatment and compliance of the treatment. Then the compliance improves and efficacy of the treatment definitely improves. And other treatment options are weight loss. As obesity and overweight is a risk factor in majority of people, definitely weight loss through the dietary modifications, physical activity, and in few people who are morbidly obese, the surgical options like bariatric surgery definitely helps you in losing weight. But it can be very difficult to maintain the weight loss. That is a drawback of this treatment option. And other thing is avoid alcohol and sedatives. Alcohol definitely increases your daytime sleepiness and also definitely hampers the awakenings following apneic episodes that may prolong the apneic episode, which may lead to the detrimental effect. So avoid sedatives, and we advise no or little alcohol to the patients who have been suffering from OSA. And other options are behavioral and lifestyle changes. So definitely that improves your quality of life. And another option is oral appliances. These oral appliances like mandibular advancement appliance. So these oral appliances, they reposition the jaw and pulls the tongue and soft palate forward and creating the space in the throat. So the most common issues with the oral appliances are comfort, and most of the patients, they don't feel like comfort while using oral appliances. That is a drawback. And other option is nerve stimulation of upper airway muscles. So that nerve stimulation of throat muscles will activate the throat muscles and will keep the throat airway open during the sleep. But this option is we have to use certain selected patients following specific criteria. Then other option is surgical option. So this is opted in selected patients, this option, and the main goal of surgery is to creating the space and to remove the excess tissue in the throat, and by creating the space so will decrease the chances of will decrease the chances of liability to the airway narrowing. So most common surgical option is uvulopelletopharyngoplasty, UPPP. So that removes the uvula and excess tissue in the throat, and also like and even tonsils also if they are enlarged. And especially these surgical options, the major disadvantage is relapse. So after opting the surgery, patient may redevelop the symptoms after a few days or few months after surgery. So the relapse is the most common disadvantage. So that's why we use the surgical option in selected patients. Sometimes we use the surgical option along with non-surgical options like Cpap therapy. And these are the treatment options available for obstructive sleep apnea. And of course, as it affects the majority of adult population, it indirectly affects the productivity of the company and productivity of our country. So identifying your symptoms and considering your bed partners or spouse complaints regarding your snoring and excessive daytime sleepiness and seeking medical attention immediately definitely gives you an opportunity to diagnose your problem and to take treatment at the right time. Thank you so much. And now we'll take few questions. So I just got a question that, Doctor, may I know the common causes for snoring daily routine? So as we discussed, nowadays, especially in the majority of adults, because of our changing lifestyle and dietary habits, overweight and obesity is becoming very common. So that is the most common risk factor in the adult population, and reducing the weight definitely helps you a lot. In addition to that, if the snoring problem is commonly seen in your family, then probably your anatomy of the upper airway, like sometimes few people have small jaw, small throat and bigger tongue. These people are at high risk for snoring and obstructive sleep apnea. So if the majority of your family members are complaining of snoring, examination of upper airway by ENT specialist also helps you a lot. So most common risk factor is the overweight and obesity. We'll take another question. So recently underwent cardiac surgery. Any chances of developing lung related issue as he is suffering with breathing problems sometimes in the winter season? So this is a little bit unrelated to our present topic, but we'll discuss. So here the seasonal lung issues. So most common seasonal lung issues are asthma, that is a reactive airway disease. So when we expose to dust and cool weather, definitely there is a narrowing of breathing tubes in your lungs and causing breathing issues. And after proper history and chest X-ray and lung function test, we'll come to know will come to a conclusion like whether you are having asthma or a lower airway disease. So, but usually that lung issue asthma is not correlated with any cardiac issue or cardiac surgery. That is a genetical issue in many situations, many persons, many people. So that is a genetical issue. So if you are suffering from breathing problem, so then consult your pulmonologist. Definitely after taking proper history and a few investigations, he'll diagnose your problem, and also he can identify your severity of the lung issue. So I am getting sleep very late, and my husband is complaining that I am snoring while sleep. So please help me out. What are the lifestyle and food changes that will help me to get out of this issue? So here the again if you consult your specialist like pulmonologist, he'll take the full history, like what are the symptoms your bed partner or your husband is complaining about you, like snoring and awakenings, frequent awakenings, like sometimes choking and gasping episodes, and regarding your excessive daytime sleepiness and your lack of concentration and easy fatigability, early morning headaches, dry mouth, then based on that, first he advised overnight sleep study. After the sleep study, whether you are having any sleep disorders in addition to the obstructive sleep apnea. So after, based on the issue, then he'll suggest like dietary changes and lifestyle changes, and if you are overweight or obese, then even weight loss also helps you a lot. The proper food changes, dietary changes definitely, and physical activity, regular physical activity definitely helps you in reducing your weight. So are there any medical treatment available for snoring? As we discussed in the earlier of the session, so it is a mechanical problem. So there is a obstruction at the level of throat. So it's a mechanical issue. Definitely you need a machine, Cpap machine, to open the airway. Otherwise you have to wide open your airways with the help of surgery. So there is less role of medications in this issue. Treatment options for snoring. So we discussed in detail. So after diagnosing the issue in moderate to severe OSA cases, then Cpap definitely helps you. If you are not improving with Cpap, or if you are not comfort with Cpap, if there are any issues with Cpap, definitely your doctor will suggest you other treatment options. Surgery is one of them. Breathing exercises, any role of breathing exercises. So here the issue is only during sleep. So when you are awake, your airway completely normal. So breathing, there is less role of breathing issues in upper airway disorders. For lower airway, definitely physical activity definitely improves your respiratory muscle power, and simple breathing exercises, breathe in and breathe out, definitely improves your lung power. So any advice regarding food for avoiding breathing difficulty issues? So the breathing difficulty from lung side, majority upper airway and lower airway, and lower airways most commonly asthma, COPD, ILD. So here the role of food, definitely there is a role. So taking adequate, balanced diet, including high protein diet, improves your immunity and decreases the chances of developing serious lung infections. And vaccination also definitely helps you a lot. So by taking balanced diet and high protein diet with regular physical activity, definitely the chances of getting lung infections will be less. But in addition to that, taking appropriate treatment from the specialist for your lung problem is also important to improve your lung function. How do I know if I have sleep apnea? So definitely if you have symptoms like snoring, when your bed partner or spouse is complaining that you are snoring during sleep, and there are choking episodes, and you are feeling like sleepiness while you are awake, while watching TV, while sitting ideally in the sofa, or while doing your work at workplace, and after having lunch, and while driving, definitely there are chances of having obstructive sleep apnea. So consult your specialist immediately. And in addition to above symptoms, you may have a lack of concentration, early morning headaches, dryness, sore throat, and frequent awakenings during sleep to urinate. So these are all the common symptoms. When you have the following symptoms, please consult your specialist. What are the warning signs of sleep apnea? When you have daytime sleepiness, so we'll usually, based on a few scales, sleep scales, we'll measure the severity of the problem, and after conducting sleep study also we'll come to know the severity of sleep apnea. So based on that you may opt Cpap or surgical options. So with the help of few sleep scales and sleep studies, we'll come to know the severity of the sleep apnea. What negative effects can the sleep apnea cause? So usually because of this decrease in oxygen levels during sleep, periodically during every night, will gradually over a period of months or years definitely impacts your vital organ function, and you are more prone to cardiac issues like heart attacks and heart rhythm abnormalities, those are called arrhythmias, and high blood pressure in spite of using medications, and uncontrolled sugars in spite of adequate treatment, and stroke and various lung diseases. And definitely the increased sleepiness during daytime increases the chances of road traffic accidents. So these are the major consequences if you are suffering from moderate to severe grade of sleep apnea. Can sleep apnea causes diabetes? Definitely sleep apnea, because of these hypoxic episodes during sleep, that will affect the function of pancreas and affects the production of insulin, that may lead to the, and even insulin resistance, that may affect the insulin resistance. So chances of developing diabetes, and if you have diabetes, chances of getting uncontrolled sugars are also high. Sleep study, as we discussed, now we are doing home sleep studies. So there is an equipment which usually technician will come to home and connect this to you, and you need to sleep during the entire night, and by measuring various parameters like breathing effort and airflow, heart rate rhythm, oxygen levels during sleep, and stages of duration of various stages of sleep, and other issues like body movements, leg movements. Based on these parameters, will come to know the diagnosis of obstructive sleep apnea. How can we assess lung function by sitting at home itself? Few breath holding breath holding exercises, and peak flow meter is available. It's a small device, so there is a certain one maneuver is there. So by doing that maneuver, you will come to know your lung capacity. This is all after diagnosing your lung issues. So definitely you need to consult your specialist first. After diagnosing a problem, you can check your lung function regularly with the help of these devices. I think I have discussed and I have answered most of the questions. So this is our today's session. So Definitely, if you are snoring during sleep and your spouse is complaining that you are snoring and you have excessive daytime sleepiness, then definitely you need to consult your specialist and get evaluate and need if a problem is diagnosed, you need to take proper treatment. Thank you so much.